Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to talk about is coexistence of depression and anxiety. So as we know that depression and anxiety or major depressive disorder and generalized anxiety disorder are two very common or the most common mental health conditions in the entire world. But usually what happens is that they can coexist. They can both be there. And the most interesting part is that whether it's depression or anxiety, actually the main treating group of the groups of the medication to treat these conditions are the same, which are selective serotonin reuptake inhibitors or SSRIs, or we have another group called SNRIs. So they have got the same groups of medication, which are usually called as antidepressants, but they are anti-anxiety medications as well. So we'll talk all about it in today's video podcast. So let's continue. So it says that depression and anxiety are two prevalent mental health disorders that often coexist, presenting a complex interplay that can significantly impact an individual's life, like quality of life. The co-occurrence of these disorders is not merely a coincidence. Research indicates that individuals with anxiety disorders are at a heightened risk of developing depression, and of course, same is true like vice versa. This dual diagnosis can exacerbate symptoms, make it difficult for individuals to manage their daily activities. So they could be really crippling for daily activities, whether it's personal life or professional life. Symptoms of anxiety, such as excessive worry, restlessness, and irritability, can lead to feelings of hopelessness and despair, characteristic of depression. So what is anxiety characterized by? It's characterized by having excessive worries, restlessness, and irritability. And then they can lead to feelings of hopelessness, sadness, and despair, which are the characteristics of depression. Conversely, depression can intensify anxiety symptoms, creating a vicious cycle that complicates treatment and recovery. Therapeutic approaches, including cognitive behavioral therapy and medication, have been shown to be effective in addressing both conditions simultaneously. So, a person who's suffering from both anxiety and depression should be treated with both cognitive behavioral therapy or psychotherapy and medications, because when these conditions coexist, their symptoms are actually severe and intensified as compared to when they occur individually. It is crucial for clinicians to recognize the signs of both disorders in patients to provide comprehensive care that addresses the unique challenges presented by their coexistence. So as I said, one of the unique challenges is that the treatment can become a bit more difficult because their co-occurrence or coexistence will actually intensify the symptoms of both anxiety and depression. Antidepressant medications and anti-anxiety medications are often classified, actually always classified within the same groups of medications due to their overlapping mechanisms of action and efficacy in treating mood disorders. Both types of medications primarily target neurotransmitters in the brain, such as serotonin, norepinephrine, and dopamine, which are crucial in regulating mood and emotional responses. Selective serotonin reuptake inhibitors, or SSRIs, for example, are frequently prescribed for both depression and anxiety disorders as they enhance serotonin levels in the brain, leading to improved mood and reduced anxiety symptoms. Additionally, benzodiazepines, which are commonly used, benzodiazepines such as diazepam, which are commonly used for anxiety relief, can also provide immediate relief from depressive symptoms due to their sedative effects. So usually they say that there is no role as such of diazepam in depression, but some research also indicates that diazepam can also be good for depression because it calms you down, it sedates you, so that can also be helpful. Or maybe there is some other mechanism and it can also be helpful for depression. But usually benzodiazepines are the group which are primarily for anxiety disorders and not for depression, while SSRIs, and again, benzodiazepines are not long-term medications. They are only given for the first 2 to 4 weeks. The long-term medications are the same for both anxiety and depression. However, these medications share similarities. It is essential to recognize that they may also possess distinct side effects and risks, necessitating careful consideration and personalized treatment plans by healthcare providers. Understanding the nuances between antidepressants and anti-anxiety medications is crucial for effective management of these interconnected disorders and for optimizing patient outcomes. So again, though the groups are the same, so let's say SSRIs and SNRIs, but what is better for what? And so for example, if a patient only has depression, which SSRI is the best or which SNRI is the best? If a patient only has anxiety, which SSRI should be the first line and then what should be the second line? While if they both exist together, then which one should we choose? So it is more personalized and understanding the nuances between what should we start in what first. Again, the other thing is that again, it depends also on a patient's weight, the dosage and stuff. In anxiety disorders, with the first diagnosis, and if there's somebody who's having acute anxiety episode, we'll start with the benzodiazepine for 2 to 4 weeks. And then because it's not a long-term medication, after that we commence SSRIs or SNRIs. While in depression, we do not go with benzodiazepine as the first choice. We just go, if we have to start medicine, we just start with SSRIs or SNRIs. I'll see you tomorrow.